All right, well, we can go ahead and get started. Hi, everybody. So my name is Julie. I've been kind of hanging out in the background in these meetings, popping in when I can. I'm a recent graduate from the psychology program here at UW-Madison, and I am now a postdoc fellow with the Department of Family Medicine and Community Health with a primary care research fellowship. And working with the Center of Tobacco Research and Intervention on how to intervene and deliver effective interventions for folks who are addicted to tobacco, and in particular paying attention to the impacts of social and economic disadvantage and how to develop more effective interventions for those folks. And so I'm presenting a research talk today that's very much in the early stages, and would like your input on, the approach. And this is really my first project focusing on geographic level indicators of socioeconomic disadvantage. And so I'd very much like your input on using this particular type of index to understand its impacts on health and well-being. Looking in particular at daily level functioning, and so again, this is a talk that's very much in its early stage, or research that's very much in its early stages, and so feel free to interrupt with questions that you have, and it's definitely, a more casual setting as well, or casual approach as well. It is a working group, so this is very much a project that is a work in progress. So yeah, I very much appreciate your time today in being here. So I'll go ahead and get started. So first I want to mention this project is in collaboration with Emily Urban-Wojcik and Stacy Schaefer, who are both at the Center for Healthy Minds here at UW-Madison. And then also David Almeida, who is an investigator with the Midlife in the US study, who focuses on the project that addresses daily level indices of health and well-being, and understanding the role of adult development in shaping daily life. So the goal of the talk, as I mentioned before, is to just provide some background and rationale for the project, describe the particular study sample. So this is using data from the Midlife in US study, which is a national study of health and well-being, and then discuss just some very preliminary findings so far and what my next steps are. So to first provide some background, so there's been a lot of literature done so far to say that yes, exposure to and vulnerability to stressors are explanatory for understanding the linkages between socioeconomic indices and mental and physical well-being. So first, there's been a large literature that has found that individuals lower in socioeconomic status are more likely to be exposed to both acute and chronic stressful events, but they're also more likely to experience the negative health and well-being consequences as the result of stress exposure. But a lot of the literature so far has really focused on those more chronic major life stressors and its linkages with health, and explaining socioeconomic disparities in health and well-being. And there's been less of a focus on these more acute, everyday stressors that occur in individuals' lives. So daily stressors are what are considered to be more minor events that an individual experiences on a day-to-day basis. So this includes things like having an argument with a friend, thinking about how to manage finances and juggle different tasks that come up, dealing with different deadlines and conflicts at works. And a lot of research from Dr. Midas' group has found that these daily stressors do actually have an impact over time. So they both have an impact on an individual's life on a daily experience and impacting stress reactions and also daily emotional experiences. And they can also exert more long-term or downstream impacts on health as well. So these daily types of stressors have been associated to things like metabolic syndrome and diabetes and cardiovascular disease. And there's also some literature showing that these more minor, acute, everyday stressors can have an equal and perhaps a greater impact on individuals' well-being, both mental and physical, than these more infrequent major life stressors that might occur, such as losing a job or experiencing a divorce. And so connecting back up to how these daily life stressors might actually contribute to SES disparities in health and well-being. So prior work in 2005 has shown that individuals who have less education are more likely to experience more severe daily stressors. And that this education-based difference in the experience of daily stressors did explain relationships between education and different well-being and health indices. And in research that has looked and compared stressors that occur in 1995 to 2012, and looking at education-based disparities in negative affects, so an index of well-being, has found that from 1995 to 2012, there have been increasing disparities in negative affect from 1995 to 2012, and suggesting that for some reason education seems to be playing more of a role in translating to everyday experiences, including experiences of negative affect.
Julie, is this picture here, is this Midas, and is this trying to separate like a time effect versus an age effect?
Yeah, so this is, just very briefly speaking, so this is just it is a cross-time analysis. We are still, I believe David's group is still analyzing the longitudinal within-person data. So in this particular paper, they've tried to pull out different age effects and cohort effects. So this is more of a descriptive approach in comparing these gradients from 1995 to 2012. And they've also looked at this relationship by age as well, and have found some differences between the age groups as well, and that particularly in younger adults, the gaps in negative affect have widened more for the younger age groups. I don't know if that exactly answered your question.
Well, I'm not a Midas expert, so maybe my question is, in 2012, is there a refresher or of younger ages so that they're actually, these two time periods are balanced by age?
Mm-hmm. Right, yeah. So in 2012, a new sample of adults was collected
Okay.
of comparable age ranges, 25 to 75, as the original 1995, which has the same age range of 25 to 75.
Thanks. That's helpful.
Yeah. Yeah. And so primarily these analyses have focused on education as an index of socioeconomic status, largely because with other indices, like with income and wealth, there's a lot of missingness, and those also rely on self-report. And so education, although it does have its limitations in other aspects, it is reported across all participants. And education is also, linked to other facets like health behaviors and other aspects of health that make it an index of social standing. And sorry, my cat is trying to now get in the door, so I'm just gonna open that up so she's not trying to take the door down. So as I was saying, these analyses that try to understand contributions of daily experiences to disparities in health and well-being are largely limited to education as an index of SES. There's limited understanding of whether these findings generalize to other indices, including at the contextual level, which is where I'm bringing in the area deprivation index to this analysis. Okay, so I don't know how many of you are familiar with the area deprivation index. So this is a composite index of socioeconomic disadvantage, which was originally created by the Health Resources and Services Administration for the county level use. But in around 2014, Amy Kind, who is a physician scientist, she has adapted this measure to construct it at a more fine-grained neighborhood level to get at a more fine point of area disadvantage than the county level. And so here's the area deprivation index rankings based on the 2018 data across the different neighborhood level. So again, I'm really new to this as an indicator, and I've just more recently been trying to understand what all goes into it. And so again, if you have insights on this index and some of its, limitations of using this, broad categorization that kind of brings in all these different domains of social determinants of health. So I can just list some of the domains that are included for those who might, not have knowledge on, what goes into this. So it includes indices related to income. So I have more of a written paragraph here that, so it has an index of median family income, median home values, median gross rent, median monthly mortgage, income disparity, unemployment, percent unemployed in white collar occupation, percent families below poverty level, percent population below 150%, the poverty threshold, the single parent household rate, home ownership rate, percent household without a telephone, percent households without a motor vehicle, percent occupied housing units without complete plumbing, and household crowding. So here you can see that it really is, the kitchen sink when it comes to getting a sense of what the degree of neighborhood disadvantage is. And so I'm just curious, what your reaction to this type of index is as an indicator of socioeconomic standing, or if you've worked with this type of indicator before and trying to understand how this community or contextual level factor influences health or relates to health outcomes. Jason, have you used this or worked with this type of indicator before?
Oh, that's what when I first saw, I saw Bill and I've seen Amy give talks about this. So, but it's been a little while, so I was kind of trying to remind myself, because when you're putting up this, like the slide you have now, I was first thinking, well, that looks like a map of cities. Like if you go in those deep red areas in the South, the bits of blue are like I see Nashville, Atlanta, like I see the blue areas I see are cities. I'm wondering whether, and then while you were talking, I went on the website and downloaded the Wisconsin state version of this to see, like, within cities, because it's hard to tell with this, with the resolution on the screen, whether Milwaukee is that blue. And if you do it at the state level, you'll see like a ring of blue around the center city of Milwaukee, then deep red in the city of Milwaukee. So that's interesting.
Sorry, can you hear me, Julie?
Yeah, I can hear you, Eva.
I was going to say, I'm working with this index for my dissertation as well, and I'm interested in some similar questions. But just getting back to what Jason was just saying, there are two indices. It's a relative value. So I believe at the national level, these are, I don't know if they're broken up into like upper percentiles versus at the state level, you can have relative values at the decile. So there's a state relative value, and then there's a national relative value. I think you've already dealt with that. And so that might be accounting for some of this, blue centering around cities versus if you look at it at the state level, there might be some more nuance.
Yeah.
I mean, by state level, I mean the state relative index, not looking at the national index, not looking at one state at the with a national index. But anyway, so I'm interested in similar questions as you. But we can talk about it also separately.
So I do focus on the state level ranking and not the national level to get at to kind of account for those within state factors and so I know so I'll just move on to the next so
because I don't know that this probably won't matter directly for your talk, Julie, but since you're both working on it, and Katie might chime in too, there's this this difference between absolute and relative rankings of or measures, which is to say that when you take, like, I can see some real benefits of doing that within state, Ava, because like I said, like this looks like to me just some unadjusted income differences based on city versus rural. But if you go, or city versus non-city, but if you think about relative, just to get to your point, Ava, well, then if it's relative, then every state has bad places and good places from the deprivation. So you wonder like what it means to be deprived if it's relative deprivation, which is to say you guarantee that every state has deprived areas, and that presents its own challenge, because you think about deprivation in Wisconsin versus deprivation in Alabama or California, and trying to like put all that in one model also seems seems to have some issues.
Agreed.
So that's mainly the type of insight I was hoping for is, what are some of the disadvantages of just kind of lumping everything together and also relying on this more relative model disadvantage. And especially, when you have a more select sample as well, like with Midas, which we actually do see variability in these different rankings. But anyways, I'll just move on and to get to some of the findings.
I do have a question if you don't mind me jump in. Yeah, hi Julie.
Yeah, hi.
I wonder if you have a feel for the missingness in this data versus the missingness that you might find in like say like just a general measure of income for counties.
Yeah, that is a very good question. I believe on the website for the neighborhood atlas, they do describe that there will be some missingness for particular neighborhoods that don't have the level of information to compute it, but yeah, I do not know yet what that degree is or how that would impact the analyses. And Ava, do you have any insight on that?
So I haven't looked into missingness specifically, but since this index is based on it's based on the American Community Survey, it's going to be reflective of the missingness, like of that survey itself. So, and that's, I mean, that happens every year for a sample of the population. So, yeah.
Yeah, and so that brings another good point. I couldn't remember if I had that in my slide or not, is that, these indices are drawn from the American Community Survey. And so that's it's also a 5-year aggregate of the data. And the particular one that I use is the 2013 level of information, because that was the one that was closest to when the data were collected for the daily diary sample. But there is now a more recently revised, or the more recently updated 2018 version, which is uses a somewhat different calculation. But I'm relying on an older one because that was the one that was linked with the addresses for the participants in the midlife in the US study. So so that's one of the things, the downsides of using an index that's you don't have direct control over computing yourself. And then so I'm definitely not as aware of some of the other nuances in this. And I'm really appreciative of your questions and things to consider that that could impact the findings in my approach. Okay, but I mean, one of the benefits of the Area Deprivation Index is that it is something that you can use without directly relying on participants to give their information related to their wealth and income. And so it reduces the participant burden. And so the appeal is to, use this composite index as a proxy measure for SES to understand vulnerability to stress and also understand how potentially disparities in stress exposures could account for widening inequities that we're seeing in both health and well-being over time. Okay, so my research questions here are pretty straightforward. So just using the more recent 2013 data, do we replicate some of the previous findings that were found with the original Midas study? And then also using this indicator of area deprivation to examine associations with daily stress and mental and physical well-being. And then another research goal, which I won't be covering here, because first, you need to establish those linkages before moving forward to seeing how education and ADI might serve as moderators of experiences between daily stress and mental and physical well-being outcomes. Okay, so so all of these questions are drawing from a subsample of what is called the Midas refresher study. So the midlife in the US study is a longitudinal study of health and well-being that's been going on since 1995. And it's in its third wave of data collection that has been slowed down recently because of COVID-19. So we're still drawing on biological data for the third wave of the study, which has been put off for now, just because we can't bring in participants to get those data. But there's also another sample that was brought in, which Jason had brought up earlier, is what is called the Midas refresher sample. So this is essentially a sample that's meant to, add to the original longitudinal study, because we've had a lot of attrition over time due to mortality and also dropout. So to continue on the study, we brought in additional 3,600 participants in 2012, and they've also undergone the same set of studies. So there's the daily diary project in addition to the survey, and then there's also a medical visit that they undergo, where they're brought in the medical research lab and have blood samples drawn, and then also another subset will participate or has participated in a neuroscience assessment as well. So it's a complicated project in that it has all these different sub-projects and subsamples within it. But for this particular study, I'm just relying on cross-sectional data for now to first establish these associations, and then focusing on the subsample of participants who've actually participated in this daily diary component, which I'll explain more as we go on. Okay, so this is just describing what that subsample who participated in the daily diary project, some of their characteristics. So it's about a little over half identify as female. The age range is between 25 and 75, with an average age of 48. And it's a majority white sample. 70% are either married or living with a partner. About half has a bachelor's degree or higher. And then on a ranking, using that state level index of the area deprivation, which ranges from 1 to 10, which again is a relative ranking. The average was 4.76 out of 10. And then around 12.1% are retired, and only 3.5% were unemployed at the time. Okay, so then just going into what are the actual data that are collected in this daily diary study. So participants are interviewed over the course of 8 consecutive days. And in this interview, which is a phone-based interview, they are asked about their the number, type, and severity of daily stressors that they experience. And then on the flip side, more recently in 2012, with this refresher project, instead of just focusing on the stressful events that happen, there's also information on daily positive events that happen as well. And again, this hasn't been studied as much as looking at the downsides of daily life. So I think this is also an interesting area of study as well, but not something I'll be focusing on for this particular project. And then another aspect of the interview is that They also talk about their experiences with positive and negative affect over the course of the day. And then they also report the number, type, and severity of physical symptoms. And I'll describe each of these measures in more detail. And then, so summing across the 782 participants in those 8 days, with some missing data, what you tend to see is that participants, a few participants will drop off towards the end of the week. But in total, we have 5,849 observations total across the 782 participants. Okay, so now just going into what is exactly asked in these interviews. So either at the end of the day or the start of the day, depending on the participant's preference, they'll be interviewed about what kind of stressors they experienced either the day before, if they're interviewed the morning of, or the end of the day. And I should mention that most participants prefer to be interviewed at the end of the day, so most of these relate to that particular day. There are just some participants that had a preference to be interviewed in the morning instead. So one of the questions asks, so did you have an argument or disagreement with anyone since the time we spoke yesterday? And so on average, across those total observations, about 10.3% of those observations, someone reported that they had an argument or disagreement. They were also asked if they could have had an argument or disagreement, but decide to let it pass. And you can see that more people, or more often individuals, are likely to report that occurred. And then they're also asked about any situation that occurs at work or school that most people would consider stressful. And then any situation at home that most people would consider stressful. And then also experiences with discrimination. And again, with our majority white sample, there's very infrequent or quite infrequent reporting of that occurring. And then any experience that a close friend or relative had that turned out to be stressful for you. And then they were also asked to report any other stressful experiences. So this is really, a broad brush approach to get at stress exposure. Again, because these are face-to-face interviews, you have to balance quality with time. And so I believe these interviews aren't meant to last, more than 45 minutes. So that is one of the limitations with these phone-based interviews. Oh, sorry, Jason, are you trying to say something? Oh, okay. Yeah. Okay. So that's one of the limitations of this approach with the phone-based interviews, is that you might not be able to get as much detail, but still, at least you're able to get some sort of sense of what an everyday experience somebody might be going through. Okay. And so the main outcome that I focused on was ratings of severity of those different events. And so that only applies to when participants actually report a stressor occurring on that day. So summing across all the participants, there were 2,240 total ratings of stressor severity. And severity is rated just on a scale of 0 to 3, from not at all stressful to very stressful of that particular event. And then this was an average across whatever number of stressors that they reported for that particular day. Okay, and then turning to average daily negative affect. So this is based on the positive and negative affect schedule. So, so specifically for negative affect, they're asked, how restless or fidgety, nervous, worthless, and so on a scale of none of the time to all of the time. And then for positive affect, again, asked to rate the frequency of experiencing these different positive emotional experiences. Okay.
Julie, Alethea raised a question about the coding. 2 slides ago,
yeah.
You had people who nominated a stressful event, but then coded it as a 0. One forward. Yeah.
Yeah. So they nominated a stressful event, but they then had the option to rate the severity. So, yeah, I think it's interesting that people would say that they experienced a stressful event, but then in some cases not rate it as being as perceiving it as stressful. So there's so this is more looking at the subjectivity of the stressful event, and then whereas just trying to get an idea of the number and types of stressors that occurred.
But do you have a sense of if this is coming from, wasn't one of the questions like, do other people think it was stressful? And then you can say, I'm just wondering where this is like conceptually possible to nominate that you did have a stressor.
Yeah.
Is it like the 4th one down? Or maybe the 3rd or the 4th one down. You can say that there was a stressor that other people would think, but then you would rate it a 0. Is that like a logically consistent way of doing this?
Yeah. I mean, that's how it has been coded. And and that's the other thing too with this is that there are a number of ways to conceptualize. You have the event itself, which you could focus on in itself, and then and try to characterize the variation and types of events that are experienced. And then you have the perceived severity of the event. So how much of an impact did this event have on the individual?
Maybe
or
what
you
I
could
was
just
confused about, sorry to interrupt. I think it's more the title. So the title that says stressor that occurred since last time interviewed, is that the actual language, or is that like yours or the studies? So like if you just read, a question, have you had an argument or disagreement? You could say yes to that and say that it wasn't stressful. So I'm wondering if these are meant to be capturing perceived stressful events, that then someone would say, oh, I actually didn't find it stressful, so I'm going to mark it as a 0, like how that logical chain happens.
Yeah, so I think they didn't want to impose the perceived stress aspect on this particular type of question yet. They just wanted to get a reporting of potentially perceived negative events or stressors, and then have them go on to rate, okay, so then this event occurred, then how stressful was this for you? And then you have
it's really like the first line that's the misnomer, that stressor that occurred since last interview, that's actually not imposed on the questioner.
They're
more like events that occurred since last interview or something like that.
Right. Yeah. I think making that more clear, because I can read some of the wording that happens with the interview. So just, so for the first one, it asked, did you have an argument or disagreement with anyone since the last time we spoke yesterday? So again, it doesn't really use that specific language of being a stressor. The only time that language is used is when they ask about something that that other people would consider stressful, or or being asked about any other particular events that potentially could be perceived as stressful, to kind of get those more open-ended. So you're not just constraining to those specific events, but you're able to get a broader scope of what people are experiencing. And so I think there, with this type of data, there's a little bit more rich, like qualitative data that would take a bit of time to get into, because I think they do have data on the different events that are reported. And then there's also, raters that actually look at those events and try to, rate from their perspective how stressful those are as well. But I'm not digging too far into that. That would take a lot more legwork to get into. But I think it's always important to disentangle, what is perceived versus what is, just might be experienced throughout the day, but not necessarily considered to be stressful.
Thanks for that.
So that explains. So that's a very roundabout way of getting at Leafia's question on, why somebody might rate it as not being stressful, because they might not have thought the event to begin with was particularly stressful. Okay. And all right. And it's also interesting to see the differences in the range of, so with negative affect, it's the mode response is very little negative affect, and it's very rarely that you get higher degrees of negative affect throughout the day. Whereas with positive affect, it's much more distributed. And then, so I believe physical symptom severity, that's the last outcome measure. So again, this is another measure that is a whole host of different physical symptoms that are experienced on a daily basis. And I think this is something that also requires a little more nuance and understanding, because it gets at some more, chronic health conditions, but also more acute conditions. And also, symptoms related to menopause, and so again, I think this is a very, blunt instrument to get at physical health, but again, it's a starting point, and okay, and so now looking at the indices of socioeconomic status for this particular study. So education attainment, I have on a scale of 1 through 10. So 1 represents individuals with just grade school level of education. And then a 10 represents individuals with a doctorate or professional degree. And so here is where it shows the distribution of the state ranking of the area deprivation index. So here is where I mentioned it's the 5-year average of the 2013 American Community Survey data. And so higher relative ranking means that it's an area with relatively more deprivation compared to other neighborhoods in that particular state. And so it's somewhat distributed. Most participants, or not most, but a higher number are clustered around those with areas with less disadvantage, but there's still so a little over 30 participants who are in one of the most significantly deprived neighborhoods. And then, so one question is, how separable are these different indices of SES? And And not surprisingly, there's quite a bit of, there's actually not a whole lot of overlap between these two indices, which is, again, not surprising because the ADI is a contextual level factor that takes into account many different indices of disadvantage at the neighborhood level, whereas education is just a single individual level index of advantage. And so the R squared between them is 0.1. So education explains about 10% of the variance in area deprivation. Okay, and then moving on to just these very preliminary findings. So just because these are repeated observations within individuals, I used multi-level linear modeling techniques to examine the associations between education with daily stress severity and positive negative affect and physical symptom severity. And then same with the state area deprivation index as well. And so these were examined in separate models, just unadjusted, just to first see if there is a relationship with these different health and well-being outcomes and daily stress. So here on the top of the table are the different outcomes that were examined, and then education and state area deprivation index. And so just looking at the coefficients and confidence intervals, which are in the brackets, education and state ADI show similar, modest associations with these different outcomes. And with physical symptom severity, except with physical symptom severity, education explains a bit more variance in physical symptoms relative to state ADI. But again, these are just very, blunt approaches for testing these associations. And I think there's still a lot more work to do to really understand these different associations.
I think Ava and Leafia both have questions about interpretation.
Okay. Right, so higher ADI is more deprivation. So you're gonna see, so with stressor severity, those who have a higher ADI have more deprivation, and that's linked with greater stressor, perceived stressor severity. Whereas with education, it's the opposite pattern because higher education is associated with more advantage and lower stressor severity.
Can you remind me of the scales of ADI and education? Is ADI like 1 to 100 or something?
No, it is just 1 through 10. So
1 through 10, okay.
Yeah. So these are very, very modest associations, and education as well is a scale of 1 through 10. Okay. And education is also not associated with positive affect, but and also ADI was not strongly associated with positive affect as well. Both education and state ADI were associated in the expected directions with negative affect, and then with physical symptom severity as well. They were both associated in expected directions.
I'm sorry. Sorry. I'm sorry for jumping in. Yeah. So I think you just the education and ADI are not controlled in the same model. Is that it's my understand right?
Right. Yeah. Yeah. These are just unadjusted. Largely because I just wanted to first look at their unique associations with these different outcomes before moving on. Yeah. Yeah, so I mean, this just speaks to this being at the very early stages. And before I did more, hypothesis-driven types of analyses, I wanted to get feedback from this group and, give some context for this study. And so yes, these are definitely not the full models that I'll be going over yet. And I think. Did anyone else have questions? So I see.
Hi, Julie. Yeah, I had a question along the lines of the scale for education. It's from 1 to 10, and I noticed like 8 was very low in the distribution. And I'm just kind of wondering like what these groups represent and whether or not we should be thinking of education as like a linear relationship, or if it's truly categorical, in which case then like the difference between education equals to 9 should not be between 8 and 9 should not necessarily be equal to the difference between like education equal 2 versus 3.
Yeah, so that's exactly right. Like, so that is one of my next steps in this project, is to think about this in a more categorical way, because this 8 represents folks who have 2 to 3 years of a bachelor's degree, but did not complete their bachelor's degree, which represents a very small amount of the sample. And then 9 are individuals who have a master's degree, 8 represents those who have some master's level education, but do not have a completed master's degree. 9 represents those with a master's degree, and then 10 represents those with a professional degree. And then 7 represents bachelor's educated folks. So I think that's a very good point, is that the steps don't represent, equal increases across the different steps of the gradient. So that is my next step, is to examine in more meaningful categories differences.
Julie, just let me know if I'm jumping the gun with this question, and maybe you're going to address it, but I forgot about the design from Midas, but it's a national survey, right?
Right, yeah.
Okay, so the question is just in terms of simple, just going back to your regression and because the state level indices, like we were talking about before, are relative at the state level. So I'm wondering why you're not including something like a separate intercept for states, or I mean, maybe you will be doing that, and this is just a crude association, but like a random intercept for state, just to account for some of those differences. Or I don't know if there are, better ways of dealing with the fact that this measure is not that a 5 for one individual is not the same as a 5 for another individual. Just as a baseline crude measure, like before you go on and add in covariates. That may want to be, that you may want that to be a part of your just base model.
Yeah, no, that's a really good point. So that's definitely one of the disadvantages of using this composite index, because because this was all linked separately by another individual who went through the protected data with their addresses and then linked, the 9-digit zip code with the ADI information from 2013. And so, I would have to go back to that individual or whoever is doing that process and have them actually give me the assigned states through each participant, because that's something that is not in the public data, is the participant state. I believe just the region, only the region is publicly available. So I would have to then go through and create another de-identified coding essentially for the individual state, and use that as a control variable. Yeah, but that's a really good point, is because a 5 for somebody in Wisconsin might mean something different for somebody who lives in Georgia or Louisiana.
Right. I mean, if you were analyzing it at a just, state level, then obviously the state just makes sense. But since you're doing it nationally, I think that would be an important component to include.
Yeah. And and I have not looked at the national index as well either. I've only worked with the state rankings. Okay. And so my next steps are to get at those nonlinear associations that Katie had mentioned, and then to go on and continue to get feedback from other folks who are more knowledgeable in this area of research on how to appropriately model associations between geocoded indices of area deprivation and health outcomes, and then potentially, if once I get my head more around this type of data, working with this data, go on to examine some next questions related to moderation, and really trying to understand the linkages between daily stress and mental and physical well-being, and understanding, reactivity to these daily stressors, and how both contextual level and individual level indices of SES might influence those relationships. Okay, so I really am thankful for everyone's interactions and clarification questions. So I'll just open it up. I already took an hour of everybody's time, so I also understand if folks are eager to move on. And but any questions?
We have a queue now, so Boyan and then Leafia.
Thank you very much for your talk, and I think they are very interesting questions. And I think probably I think I have a suggestion for your first aim at first. So I think it would be interesting to know how would the individual education interact with the area deprivation index. Like, for example, how would probably a highly educated, highly advantaged people feel when they are living in a relative? How would a highly educated, highly advantaged people fare in a very, say, low quality neighborhood? There could be perhaps interaction and a nonlinear relationship between education and area deprivation index in terms of their association with the likelihood of stressor events or some other physical measures. So I think that's my first suggestion. And I also have probably two suggestions for the modeling. First, I would consider, because those subjective or positive and negative effect measures are measured every day, I would consider if the everyday's feelings or mode will have some continuity between days. I mean, the feelings you have yesterday, you may carry it on and then influence your next day feelings. So probably you can consider some add compound symmetry model to your mixed model, which basically means you add something like AR1 or auto-regression elements to your mixed effect model, which I think would be kind of simpler in data if you are using it. And probably you can check if there are any auto-regression relations here that could improve the mixed model, I think. And also, I think another suggestion I would like to say is that for your second research aim, since you are interacting with level 2 individual education and area deprivation index with the level 1 stressor event or stress severity, because the severity is varying by day, I think you may consider use fixed effects model instead of mixed effects model, because I mean, although the say education and the ADI will be erased in the fixed effects model, their interaction with everyday stress severity will remain, and probably that would be a more powerful model, a modeling approach. And I think they are my suggestions. Thanks.
Yeah. Yeah, I think that makes sense. But when I do want to examine within associations between daily stress and daily well-being, that's when I would have to go back to the multi-level modeling. But if I was just looking at between subjects predictors, I think, yeah, working with fixed effects makes sense.
Leafia.
Yeah, thank you so much for a really interesting talk, Julie. I guess I have maybe two questions. The first one is related to the age range of the sample. So it's like individuals aged from 25 to 75, right? And so I'm just a little curious, do you have indicators of whether or not they're still in school? Because if we're thinking of, using education as a measure of like overall SCS or something like that, the meaning of dropping out of a program, a master's or college program, is different than still working on their degree. And 25 is, kind of an awkward spot for some people. They're still working on their college degree. For some people, a lot of us still working on our PhDs. So I'm curious if you have that information, if you can do something about that. And the second question is just, I'm very curious about your second goal, which is in the future, you're going to look at this education and area deprivation index as mediators between the link. And I'm just curious how you will be thinking about, like the way we react to daily stressors and how stressful we find them is also affected by our mental health, right? Like it's on the one hand, it's like stressors that accumulate to affect our physical mental health. On the other hand, vice versa. So I'm curious how you will be interpreting, your findings going forward, but maybe that's jumping a little bit too much ahead.
Yeah. For your first question, I'm getting at, how many individuals are actively still in school. We do have one index or one measure that asks about, their work and education status, which, asks, if they're currently employed, if they're self-employed, if they're part-time school, full-time school. So that would be one way to get at that. The one downside of that, though, is that that's drawn from the survey data, which is depending on when they're interviewed with the daily data, that could be off because we don't ask that again in the survey component. So if there's like a 2 or 3 year lag between the survey and then the daily well-being, stress and well-being assessments, there could be some error in assessing that. But I think that would at least provide some sense, at least at the beginning of the study, how many people are still in either full-time or part-time schooling. And then your second question, one way to get at the timing piece is to do something which I think Boyan, I hope I'm pronouncing your name correctly, with the sort of autoaggression, or maybe doing lagged associations. So looking at previous day stressor and linking to next day well-being experience, and then seeing how the ADI and education moderate those lagged associations throughout the week. So that would be one way. And then also reversing it and seeing how previous well-being impacts next day stress exposure, and seeing what relationships are more consistent over time. But yeah, that's a great suggestion.
Great, thank you.
Julie, I was going to add something that is similar to Boyan's lagged point, which is that when you have these 8 observations per person, per respondent, I think the models right now aren't doing a lot with that information. You know, you have your standard errors clustered, but you're kind of tagging this mean outcome rather, which is to say you could, something different, which is a little bit like the lag question, is essentially creating these, taking the person as the unit and thinking about even like standard deviations of the outcome, because you have them, you know, you have 8 draws of that person. You could think about, I think it's similar to the lag, which is just whether education and the deprivation index is related to trajectories in some, you know, sense over a week. But you could also think of it not just the mean, but the variation that you're finding in the stressful events and so on.
Yeah, there's a lot more nuance to achieve, and there's also been growing interest in looking at variation in types of both well-being experiences, but also in stressful and positive experiences as well. Is like, how does perhaps context, how does greater disadvantage might limit the overall, you know, experiences that you have on a day-to-day basis, not just the severity or but overall the, you know, different types of experiences that you're having. Is it more restricted and more disadvantaged context? Yeah, it's another interesting question.
We've had a really great presentation and Q&A. Anything else before we leave that someone had in mind to raise before we go?
All right. Well, yeah, thank you so much. This is the last week of the semester, so I'm really thankful for everyone showing up here today and giving great insights. And I'm glad this was recorded so I can go through and keep track of all the great suggestions. So yeah, have a great summer, everybody.